Welcome to MediByte. Today we're diving into a really big topic, permanent contraception. We're going to break down the options, talk about how effective they really are, and cover what you absolutely need to know before making such an important choice. All right, let's get right into it.
In this explainer, we'll walk you through all the options for both men and women, we'll compare just how effective they are, and cover all the key things to think about for this major family planning decision.
So if you're sure about your future family plans and you're looking for a birth control solution you don't have to think about again, well, you're in exactly the right place. We're going to explore what's really involved. Here's our game plan. First, we'll cover the basics of what it is. Then we'll look at the specific options for men and for women. After that, we'll tackle a big question. How permanent is it really? And finally, we'll talk about making an informed choice that's right for you.
Okay, so let's start with the big question. What exactly is permanent contraception? It might surprise you to learn, it's actually one of the most common forms of birth control out there, especially for couples once a woman is over 30.
At its heart, it's a medical procedure. The goal is to provide lifelong protection against pregnancy by essentially creating a permanent roadblock so that sperm and egg just can't meet up.
And let me tell you, these procedures are incredibly effective. We're talking about a success rate of over 99%. That makes them one of the most reliable forms of birth control you can get.
Think about it this way. Unlike taking a pill every day or getting an IUD that needs to be replaced every few years, this is a one-and-done procedure. Once it's confirmed to be working, you don't really have to think about birth control ever again.
First up, let's dive into the option available for men. It's a procedure called a vasectomy.
So a vasectomy works by targeting the vas deferens. Those are the tubes that carry sperm. It's a pretty straightforward procedure, usually done right in a urologist's office in about 20 minutes with just a local anesthetic. But, and this is really important, it doesn't work right away. It takes about 3 months to clear out any remaining sperm, and you'll have to get a lab test to confirm you're all clear.
So how effective is it? Well, the chance of pregnancy in the first year after a vasectomy is just unbelievably low. We're talking about 0.15%. That's a tiny, tiny fraction of 1%. And while it's a very, very safe procedure, like any medical procedure, there are some potential minor complications to be aware of. Things like a blood clot in the scrotum or maybe an inflammatory reaction. And in super rare cases, we're talking less than 1% of the time, the tubes can actually reconnect all on their own.
Okay, let's switch gears and talk about the options for women. This is called tubal sterilization, but you've probably heard it called by its more common name, getting your tubes tied.
Now for women, the process is a little more involved. The most common method is a minimally invasive surgery called laparoscopy, which is done under general anesthetic. A surgeon makes a couple of tiny incisions and then uses a small camera to either block, seal, or sometimes even completely remove the fallopian tubes. The good news is, it's usually an outpatient procedure, which means you can typically go home the same day.
The effectiveness here is also fantastic. In the first year, the pregnancy rate is only about 0.6%. Now, it's worth knowing that over a 10-year span, that can go up a little bit to about 2%, but it's still an incredibly effective method.
Complications are also pretty uncommon. You might see some minor things like an infection at the incision site. Major complications are rare, but there's one really critical risk to understand. If a pregnancy does happen after this procedure, there's about a 1 in 3 chance it could be an ectopic pregnancy, where the embryo implants outside the uterus, and that is a serious medical emergency.
So, let's put these two options side by side. Generally speaking, a vasectomy is a simpler, quicker procedure with a slightly lower failure rate. It's done in a doctor's office with local anesthesia. On the other hand, female sterilization is a more invasive surgery that happens in an operating room under general anesthesia.
All right, now for a really crucial question. We keep using the word permanent, but just how permanent is it? What happens if you change your mind down the road? This is probably one of the biggest questions people have. And the answer is, well, it's complicated. While reversal surgery is sometimes possible, it's definitely not like hitting an undo button. It's a complex, often expensive operation that, frankly, doesn't always work. Yeah, the success rates for a reversal aren't all that high. For a man who has a vasectomy reversal, the chance of a successful pregnancy is only around 26%. For women, it can vary a lot depending on their age and the type of procedure they had. The key takeaway here is pretty clear. You absolutely cannot count on a reversal being successful.
So, with all of that information on the table, how do you actually make the right choice for you and your family? What should you be thinking about?
Ultimately, this is a deeply, deeply personal decision.
The number one factor is being absolutely certain that you don't want any more children in the future. It's just so important to have a really thorough conversation with your partner and your doctor to weigh all the pros and cons for your specific situation.
If there is one thing you take away from this entire explainer, please let it be this. This form of contraception should always be considered permanent. You should go into this decision assuming it is for life.
We really hope this has been helpful. Of course, the best next step is to continue the conversation with a qualified medical professional. Thank you so much for watching this MediByte explainer. For more clear and trusted health information, please remember to like, share, and subscribe to our channel.